Ladies and gentlemen, I'm back again for another conversation from the couch. My name is Mark Drax. I'm coming to you from England on behalf of SASH, the Society for the Advancement of Sexual Health. And today I'm thrilled to welcome from way across the pond from me, Dr. Wilson Kenney. Wilson, a very good afternoon to you.
Good afternoon to you.
Wilson, you are incredibly kindly going to be speaking at our upcoming conference in October. And very, very sadly, I can't even get over to see you live now because I'm still not allowed into your country, which is a great shame because I've been longing for this conference, having been a part of setting it up. But Wilson, we're here to give our audience and anyone that might be keen to know what you're talking about a little snapshot so they can check it out before they come and join us, hopefully in a month's time. So I'm going to hand over to you and say welcome. And Wilson, could you tell us about your presentation?
Certainly. So the presentation is called Problematic Sexual Behavior in Schools. And the focus of it is to help the learners understand a little bit more about the unique kinds of ways that problematic sexual behavior presents in schools, and also some of the difficulties that schools may face with regard to their obligation to provide education to all students, regardless of the things they're struggling with. And then I'll be talking about a methodology that I've developed to help schools identify kids with problematic sexual behavior early on, and to provide supervision strategies that are unobtrusive and protect the reputation of the students who are involved in the problematic sexual behavior.
That's an incredible, I mean, this is, I'm tempted to say niche market. I mean, how did you get involved in this? This is incredible.
Yeah, that's a great question. So my background is specifically in the treatment and assessment of problematic sexual behavior in adults and adolescents. And when I first got done with graduate school, I worked as a school psychologist for many years because it was lucrative and I enjoyed doing evaluations. And in the course of that, I became acquainted with some of the other psychologists who were doing work specifically around threat assessment. And at that time, the focus was primarily upon looking at violence in schools and trying to identify potential school shooters. But they realized that over the course of that time that they also needed a model to help identify kids with problematic sexual behavior. And I just happened to be in the right place at the right time with the right training. And so I was hired by a school district, Salem-Keizer School District, to develop a model for them that would align with the model that they already had that was focusing mostly on violence. And so that's what I did. And I developed a strategy that could be used for schools to help identify kids. One of the lovely things about it is it's really designed to identify those early behaviors. So although it's not an entirely prevention-based model, right, because we really need to see some type of behavior before any kind of intervention or supervision strategy can occur, we're able to identify kids very early on so that we can get to those behaviors before you're really causing that huge difficulty with kind of the contagion of sexual abuse that oftentimes occurs.
Wilson, would you say this is largely stemming from children's access to pornography on electronic devices?
That is certainly not helping.
Yeah, I bet.
That is part of it. One of the things that we talk about, and I'll talk about in my lecture, is that whenever we see any kind of problematic sexual behavior, it should encourage us to be curious, right? Try to figure out what's underlying that. And sometimes it can be things that are really innocuous and really completely unrelated to any kind of sexual behavior. But sometimes it can be something more sinister. It can be, a premature introduction to pornography. It could possibly be someone in the household, an older brother who's talking a lot about sex to the younger kids. Sometimes it could be a situation where, you've got a newly singled parent who's having, a lot of dating, and suddenly this child's becoming more focused upon sexuality and some of the things that are happening in the home. So it's not always necessarily something as insidious as pornography, but obviously, oftentimes that is certainly one of the things we're struggling with.
Makes a lot of sense. This is a fantastic topic. I'm a sex addict in recovery. I'm 54, and I came in from the cold on the 14th of June 2004 was the D-Day when a very brave lady busted me. And I've now had time in the last however many years that is of recovery and getting myself sorted out to reflect on a lot of things from my youth. And I can trace right back to my kindergarten school when I was 5 years of age. Yeah. And I was already so angry from being abused by my nanny, who physically abused me, that I was already age 5 lifting up girls' skirts on the playground and taunting them because I was already seeking that revenge against women for what a woman had already done to me. So very powerful. I know from personal, painful, lifelong experience, the devastating damage done, that if done to a child, how that then manifests through life. So for the fact that you're tackling children, helping children stop this perhaps before they even get to their 20s is fantastic. So when I saw the title of your topic, I was so excited to meet and talk to you. So thank you for what you're doing.
Well,
bearing in mind,
Mark, and I just want to salute you and your bravery for facing some of those issues, because they're very challenging to confront, and that also is a very takes a lot of courage to be able to talk about that and to confront that in yourself. So good for you. That's great.
Thank you. Well, it's why I do what I do. I mean, I'm not a therapist, I'm actually a trained coach, but I specialize in helping men who have been traumatized and who show up on my doorstep from someone like you, actually, from a therapist typically, or from some of the treatment centers I now know. And I help coach them back into life. I'm able to do what I do because I definitely understand what they're going through, especially if they're presenting with sexual issues, because I've lived with it for 54 years.
Yeah.
Tell me,
things show up in early childhood. And I think if we all think back to like our early experiences in primary school, you'll have remembrances of things that were unusual or kids who were struggling with things. I can remember a game that was really popular when I was in elementary school, where the boys would chase the girls and spank the girls, and then the girls would chase the boys and spank the boys. And it seems like a silly childhood game, but years after the fact, you come to learn that some of the kids who were kind of leading that game were struggling. They were being victimized and acting out in ways that the rest of us didn't really entirely understand, but were kind of a party to in some ways. So those behaviors are there. I think we all are familiar with them on some level. And what I want to do is just create an environment in which we can identify those kids in a way that doesn't shame them or influence their reputation, but to be able to provide a structure for them where they can feel safe at school and the other kids at school can feel safe as well.
It's beautiful, Wilson. It's such beautiful work you're doing. I'm a great believer in the concept that bullies of whatever nature often need even more help than their victims, because you have to ask yourself, how does a 5-year-old come to be that aggressive on a playground in the first place?
Yeah.
And if people had started asking why I was losing my temper violently, by the age of 5 and 6, if people decided to ask why, I might not have had such a challenging path through life, but hey, I can't change it now. So I'm sure as hell not going to start blaming anybody now. I just make sure I live very differently today. Wilson, bearing in mind you're currently speaking at a conference called SASH, the Society for the Advancement of Sexual Health. How do you think what you're doing contributes towards sexual health?
Yeah, that's a great question. The way I think it contributes to that is, I think you gave a great example, Mark, from your own life, right? But when we don't identify these things and address them early on, then they're allowed to grow more and more cancerous over the course of time. And you take a child who may be struggling with problematic sexual behavior for things that they're trying to understand, or things that have happened to them, or things that they've seen that are confusing. And down the road, if that child does not receive the supervision and intervention that's going to benefit them, those problems can grow much larger and become more problematic and can harm others. So in my mind, one of the keys to sexual health is making sure that we're getting interventions to kids who are struggling with problematic sexual behavior as soon as we see those behaviors, right? Yeah. That'll ensure that those kids can go on and have healthy sex lives, and also too, not go and create more of that abuse as they go out in their lives and harm others. So to me, it's really a key component, that early identification and intervention. Oh,
I'm so sorry I'm not going to be there to witness your talk, because this is just gold dust for me, and for me helping other people too. And what if you could name a couple of things that you might like anyone attending your presentation to take away with them, what would they be?
I think the most important thing that I want to convey to people is that all behavior is communication. And so whenever you're seeing any kind of behavior that is curious or seems inappropriate or concerning, instead of looking at that as necessarily a problem, to see it as communication and try to understand what is being communicated by that behavior. To me, that's really the key to helping to understand kids with problematic sexual behavior, or kids with any kind of problematic behavior, is to look at behavior in that way.
Beautiful. Thank you. Oh, I'm sitting here all excited with great compassion for this subject, knowing the preciousness of children and yet how many, unfortunately, do not get a good start in life. Wilson, if you wanted to tell people how to find you, or are you talking anywhere else between now and Christmas that you might like people to know about? Now is your moment to share that information.
Fantastic, I appreciate that. Yeah, I'm certainly easily found online. The company that I work for is called the Center for Integrated Intervention. We provide consultation services and forensic assessment services throughout the state of Oregon, but I've given lectures kind of all over the place on a variety of topics. I don't have anything that's coming up between now and the end of the year, but my dance card gets filled at a moment's notice. So hopefully I'll get something between now and then.
Oh, fantastic. Well, anyone that's lucky enough to dance with you, Wilson, and with the work you're doing is very lucky. So thank you. It's a privilege. I'm very sad and sorry I'm not going to get to see you in person in just over a month now. But for now, my deepest thanks for your time today, and good luck presenting at our conference in the middle of October.
Well, thanks for your time too, Mark. Take care.
Very precious. Take care. God bless. Bye-bye.